financial crisis looming for dozens of primary care and behavioral health clinics in our state.
The clinics are a vital safety net to providers and say they are losing millions of dollars a year due to uncompensated care. Your political reporter Sean Boyd has been digging into this issue.
And Sean, we could see these clinics close.
Some are already making plans to close. The crisis has been building for years due to changes in Medicaid coverage and soaring health care costs. Medicaid already makes up a third of the general fund budget, and it's increasing by $1.4 billion a year. While providers are hoping for a lifeline, it's not looking good. For more than 50 years, Salud Family Health has cared for some of the state's poorest residents, providing medical, dental, behavioral health, and pharmaceutical services to nearly 70,000 patients a year in 13 clinics across the state.
If you look at, again, Trinidad for an example, we're the only dental office that takes Medicaid. So before we opened our dental practice there, if children needed dental care, they had to drive 80 miles to Pueblo.
CEO John Santa-Stephen says many of Salud's clinics are the biggest primary care providers in their communities.
We have patients with transportation, food insecurities.
But after decades of helping those in need, Salud now needs help. Santa-Stephen says it's on track to lose $14 million this year after thousands of patients lost Medicaid. At the same time, inflation drove up costs.
I've been doing this for 28 years, and we always have our peaks and valleys and our challenges. But this is the toughest time I've seen in my career here.
It all started in May of 2023 when the federal government ended a COVID-era policy that enabled people to stay on Medicaid without proof of eligibility. Suddenly, they had to reapply. In Colorado, about 550,000 weren't renewed. Many, Santa-Stephen says, due to errors on the application, not their income. He says 47% of patients at Salud make less than 100% of the federal poverty rate, or about $15,000 for an individual and $31,000 for a family of four.
We really truly have to look at who are we supposed to be serving.
Senator Barb Kirkmeyer sits on the Joint Budget Committee and says not only has the state added undocumented residents to the Medicaid rolls at a cost of $51 million, but it's expanded services for others, even as the governor's budget provides no increase in Medicaid reimbursement rates.
We can't keep expanding. We can't keep decreasing Medicaid rates and expect these problems to go away. It's a house of cards that is on top of quicksand, and it's just bottoming out.
We operate really efficiently.
Kim Bimsteffer, head of the state's health care policy and financing, which administers Medicaid, says providers have seen a 10% increase in rates overall in the last 10 years, on top of billions in federal stimulus money. She says they may need to trim expenses, and hospitals, she says, may need to help. They just received a $54 million bump in federal funding.
The hospitals are often some of the most well-off organizations. And so we might have to take a hard look at those dollars that we're able to draw down and say, where might we have to repurpose that $54 million? And it might be rural hospitals, it might be Denver Health, or it might be our federally qualified health centers that take care of the most vulnerable, the uninsured.
Centers like Salud, which is preparing to close some rural clinics.
We call it the nuclear option. If we got to do that, that is going to be terrible.
Bimsteffer says the state may also need to pause some health care programs that increase Medicaid costs to save money. She says if the state doesn't rein in expenses, it will need to make more draconian cuts. A $1.5 billion a year increase in Medicaid is not sustainable, especially when the state has a budget shortfall, which we've talked about, of at least $700 million this year. So there are going to be some very tough decisions that the Joint Budget Committee is going to need to make.
Difficult work ahead for sure. Sean, thank you.